When laparoscopy was started, at that time maximum number of the people were doing titanium clip. And still titanium clip is used worldwide as the best method of tissue approximation. If you are using on the appendix, then it is called DS clip. This is called DS clip. That is double stand clip. This is also made up of titanium. And these are called Liga clip. Liga clip name is given by the Johnson & Johnson. They are saying Liga clip. Titanium clip, when you are applying, it is of different sizes, different color coding like blue, white, green and yellow. These are the different color, and this color depends upon, and then it depends upon the your size, like medium 2 to 7 millimeter, medium large 3 to 10 millimeter, large 5 to 13 millimeter, and extra large 7 to 16 millimeter. This is extra large. Like suppose you are doing for renal artery and splenic artery, you have to use this one. That is yellow color. For simple cystic duct, cystic artery, ovarian artery, uterine artery, you will use green color. White and blue is less used because this size of the vessel can be easily coagulated by the bipolar. But of course, sometime in the delicate structure where collateral damage chances are there, you can use blue color. So these are the different color coding which is available. Companies has given their number coding LT200, LT300, LT400. LT means Liga clip titanium. So that is number is given basically by the company. Like LT200, which is from Johnson & Johnson, may not be same for starch. Just like the car model is the number given by the company, like Maruti 800, but that doesn't mean anything. 800, why it is giving? Because it is 800 cc. But it is up to their company, whatever name they want they can keep, like Mercedes Benz or Mercedes C class, E class, S class. So this is the same way number. So number is not important, you have to remember color. And color is every company has to make same color. Like I am demonstrating you here, that this is the blue color which you will use maximum 3 mm of the vessel. This is green color, which is mostly used in cholecystectomy, appendectomy, ovarian artery and all you can use. And this is yellow color, that you will for renal artery, splenic artery, you have to use yellow color, that is extra large color. So these colors are used, and this is the applicator. An applicator has a different size of the tip, and this is openable from here. If I rotate it, we can see it is out, and I can remove it from here like this. And you have the so many sizes of the tip here, that many sizes there. You can see this is a small, this is large, this is extra large, this is medium large, all the sizes company they give you, and you have to apply the correct size, and it should be tightened here. Remember, it should be fully tight. This is a very big mistake sometimes the people they do, that suppose you have applied it, and after applying it is little loose. So I will show you what happened. See, just 1 minute. Company wise also it varies. So correct company I have to apply, because they have given me 2-3 applicator. Yes. So I am applying it here. And it is that much only. Now what will happen, you will see. See, I am pressing it, it is little open. Can you see that? It is little open. And bile leak. If your nurse hates you, just 2 times she will unscrew, that's all. one medical legal is finished. Why? Because in laparoscopy we don't have a 3D and we don't have a tactile feedback and we are pressing it too much tight. Anybody? Come here. Come here and see, she will tight it. अब उसको प्रेस कीजिए आप, जितना मन है उतना प्रेस कीजिए. प्रेस. सी इट इज स्टिल लूज. थोड़ा सा रिलीज कीजिए. देखिए स्टिल लूज. बट नाउ रिलीज इट फुल्ली. Lose it, and now I will make fully tight, and now you will feel the resistance on your finger is changed. Now press. Did you feel something? You feel hardness. So this is very important that whenever you use it, make it sure that it should not be too time loose, otherwise your bile is going to leak and you will not feel at that time anything and it will remain open. So always make it sure that it is fully tight. Fully tight. This is important. After that, you will take the appropriate size of clip. So I am opening one of them. In one clip, you have 6 loaded, and you will keep it over any hard object. Of course, your instrument trolley. And you will not open yourself, just like your nurse will open and give it to you. And then you keep it like that and press it. And see, click sound will come and it get loaded. Can you see that? It is loaded. I will show you on my hand, then it will be visible. Did you see? See, it is loaded. Now see the loaded. After that, you will hold the structure over which you want to apply, and after applying, you should rotate. Why rotate? Don't apply this way. What is the problem of applying this way? You are seeing only one jaw. Am I right? So little bit rotate like this or like that. Both the jaws should be visible. And it must be at right angle, it should not be this way. It must be at right angle and then press. And she is pressing, press. And keep it pressed for 3 to 5 seconds. And then slowly release. And after releasing, you should go up and then take it out. Remember, after releasing, directly don't pull. You go a little up so that it disengages, because sometimes it gets trapped in the groove. So directly pull, it will be loose, and then go up and then take it out. And you can see there is a nice dumbbell is formed. Did you see the dumbbell? Dumbbell means constriction in the middle and swelling either side. This dumbbell is formed and it is applied. Now, same way you will load another. Here I am loading again, and after that, when you apply second time, make it sure that distance between first and second should be 3 millimeter. You will say, how I will measure 3 millimeter? See, this thickness is 3 millimeter. So when you apply here, press 3 millimeter away from the first one, and it is applied. Chalo, press karo. And it is applied. And again keep it pressed and then open. After opening, again go up and then out. This is second is applied. And third, when you are applying, 3 you have to apply, 2 towards the organ and 1 towards the yes, suppose you are applying on the cystic duct, then 2 towards the gallbladder, 2 towards CBD, 1 towards the gallbladder. Now distance between second and third should be 6 millimeter, and then apply here. Yes, let me on the black surface and apply and press, and then open and then out. And so this is the distance between first and second should be 3 millimeter, and distance second and third is 6 millimeter, and then you cut in between. Do you know distance of the first and second? If it will be less than 3 millimeter, both will become loose. Both will become loose. This is a big mistake many surgeons they do, that if they have a small cystic duct, they apply second one very near to the first, and both will be loose. The reason being that clips are in the position due to dumbbell formation. Dumbbell means constriction in between and swelling either side. If you will apply second very near to the first, dumbbell of first will be nullified by the dumbbell of second, and first also become loose, and then it will slip. This happen in open surgery also. When you are suppose tying a uterine stump, then you are leaving some tissue in front of your knot, then you are cutting. Am I right? Why you are leaving some tissue? So that a dumbbell is formed and your knot will not slip. If you tie a knot over that swollen part of tissue, your first knot also will become loose. Or you cut that dumbbell very near to the knot, then your knot will slip. So that's why if you have a very small cystic duct, then you should be happy with the one clip only, one towards the CBD, one towards the gallbladder, and then cut in between. If you are applying second very near to the first, thinking that I am making it more strong, actually you are making first one also loose. So this is important when you are using titanium clip, that correct size should be used, correct color should be used, and correct tightness should be there over the clip, and then you will apply the properly. So take care that when you are putting the clip inside, it should not hit any organ while introducing it in. Otherwise you can damage the organ or you can lose the clip. Like suppose clip applied and without looking the pathway of entry, you are putting and it has hit the uterus or hit the liver and clip drops. 99% of the 9%, 99.9% of the time, if the clip is dropped somewhere, nothing happens if you have lost, because it will cover by some fibrotic tissue and it will get arrested. Throughout the life, nothing will happen. But there are many cases reported where clip has migrated and it has done complication. Like one of the article published in scientific journal, that one young girl was performed cholecystectomy. She was working in a circus as a gymnast, and the surgeon had performed cholecystectomy, and inadvertently during the uterine cystic artery clipping, some of the clip dropped down because he has applied, bleeding was there, so he has applied wrongly on the clots, and those clips dropped down. Nothing happened. Girl was discharged. 1 year later, while she was performing in the circus as a gymnast, she fell down due to pain and got severe backache. She was taken to the hospital and they did MRI. They found that clip was pressing one of the spinal nerve. Why? Because in the gymnast they do such a activity, they bend their body like a doll, and they do abdominal folding a lot of like a doll. So due to that pressure of the abdominal cavity, clip migrated retroperitoneoscopically, and retroperitoneally it has gone and it was pressing one of the nerve, and that's why it was painful. Another case presented, surgeon was performing hernia surgery and aberrant obturator vessel started bleeding. Aberrant obturator vessel has a problem that it bleeds from either side because it joins inferior epigastric vessel from the obturator vessel. So during hernia, if you will injure, it will bleed from below and above, both the side, because it is a anastomotic branches. So bleeding started, and in the anxiety he has applied multiple clips, and ultimately bleeding stopped. And after 3 weeks, patient came palpating those clips in the scrotum. That what is this? Why it happened? Because in laparoscopic hernia, we don't repair the muscle. What we do, we remove the sac and we reinforce the entire myopectoral orifice with the mesh. Actually, it's a bridging technique. We cover everything by the mesh, and this was a complete inguinoscrotal congenital type of hernia. So seroma developed, and due to that seroma, the mesh together with the fluid, this clip migrated into a scrotum. The scrotum was swollen with the fluid, and the clip was there. Slowly the fluid get absorbed and clip was palpated. So take care that titanium clip should not lost inside and it should not damage the organ. However, this is not a indication of conversion. Like suppose clip is lost and you could not find out, then don't open the abdomen. Just pray to God that nothing should happen, that's all. It is not an indication of conversion. It should be perpendicular to the structure, not oblique to the structure. It must be perpendicular to the structure. And both the limb of the applicator at the time of application should be visible. The distance between the twin clip should be 3 mm and distance between the sacrificed clip should be 6 mm. Twin clip means clip which you are leaving inside the abdomen, and sacrifice clip means which you are taking out with the organ. Like in nephrectomy, 2 clip will be towards the aorta, 1 towards the kidney. Cholecystectomy, 2 towards the CBD, 1 towards the gallbladder. So gallbladder 1 will be called sacrificed clip, means which comes out, and that distance would be 6 mm. If it is less than that, then it slips out. Even during cholecystectomy, it will slip out from the gallbladder side also. So bile will leak, and then you have to do suction. When you apply it, you should keep it held for 3 to 5 seconds so that it should create plastic deformation, not elastic. Like suppose you will press my nose like this and leave it, this is called elastic deformation. But if you keep it pressed like that, you can see there is a scar there, little bit a scar will form. Why? Fluid get displaced. So after pressing, immediately don't open, it will be loose. Keep it pressed for 3 to 5 seconds. 3 seconds is not 1, 2, 3. 3 seconds is 101, 101, 101, that is 3. And then open the applicator, and before pulling out, it should be up or down. Means when you are applying the clip, after opening, don't pull directly, it will be loose. After pressing, go up or down and then disengage. Because if you will directly pull, it will be loose and it may slip out. Conform the dumbbell. Dumbbell should form, a nice dumbbell should be conformed. Both the limb of the applicator must be visible, and then you should cut with the scissors. Now, Hem-o-lok is better than the clip. Hem-o-lok has this problem. So Hem-o-lok is more used nowadays, and those are considered better. So applicator of the Hem-o-lok is different. This is Hem-o-lok applicator. This is Hem-o-lok applicator. It is different. Good thing about Hem-o-lok is that you don't have a problem of tightening or loosening. It comes all together in one piece. However, you have a different sizes. Here it is a large size Hem-o-lok applicator. This is a small size Hem-o-lok applicator. And this is Hem-o-lok. It is made up of silicone. Similarly, you will keep on the solid surface and you will press it like this. And it is loaded. You can see here, it got loaded here. This is loaded. Did you see that? And once you press it, it gets locked. This is the beauty. That see, once I will press it, it will click and it is locked. Now there is no chance that it can open. That's why the name is lock. It gets locked. titanium clip is not lock, it is clip. That clip is just like the hair clip, sorry, hair pin when you are applying, and it is Hem-o-lok is like hair clip. In hair clip, when you press, it get locked at the tip. Now it will not open, you have to press something to open. But this pin, hair pin, you can pull any time out. There is no lock. So it is very important that it get locked. And Hem-o-lok is more preferred nowadays because there is no chances of slipping. Even if you will leave 3 millimeter not in front, then also it doesn't lock. This also available in different sizes: medium, large, and extra large. This is medium, large, and extra large. Normally what we use medium, large and extra large. These two are not much used. So green and yellow color, here also it is used same way. It has an advantage that it goes to the opposite to the structure and it lock. But it is less preferred. Do you know people are using less? The reason of being why it is using less, that it must be of appropriate size, so that it should go beyond and it can lock. Titanium clip has one advantage, that suppose you don't have the extra large size, then some people what they do, half they apply from this side and one they apply from this side. Am I right? And still it will work because the tip is open. Or sometime they apply like that and they cut and then they apply another hair. Got my point? That is called step ladder fashion. Or half from this side they apply and half from this side and then they cut. But Hem-o-lok you cannot do these things. If it doesn't go beyond the structure, it can never lock. Halfway you cannot lock it because it has a hinge to lock like this. Another problem of titanium clip is that post-operatively if MRI is required, then sometime it may become loose. MRI sometime is vibrating. So we can see with the MRI here it is getting little loose because of vibration. But normally Hem-o-lok has no problem because it is silicone. It is not a metal. If it is dropped somewhere also, no problem, because it is not sharp, not metal, not pointed. It cannot migrate anywhere. If you have missed it, forget it. It doesn't react with the human body. However, titanium also doesn't react. But why we are less using? 6 titanium clip will cost you only 600 rupees. And here 6 will cost you 3000 rupees. So it is expensive, little expensive. That's why titanium is more used and this is less used. Another problem of titanium clip is that 360 cases of the cat eye stone is reported, and this is a big problem. Do you know there is a big laparoscopic surgeon in the world whose name is Professor George Bursey, and Dr. Bursey is, in my knowledge, is the only laparoscopic surgeon who survived 103 years. Generally, laparoscopic surgeons, they die early and they retire early. And this is, I'm not joking to you, this is published data. It is published. So I will show you. If you will search in the net that laparoscopic surgeons retirement, and then search in the Google, then you will get it. May face early retirement due to the high physical demand of the job. And the John Hopkins Hospital, 20% of the laparoscopic surgeons due to stress. In John Hopkins Hospital, what they did, that they did one study that they put Holter ECG in the chest of the laparoscopic surgeons, and they see that what heart of laparoscopic surgeon behave like. And they saw that beginners up to 2 to 3 years of their early practice, in the major surgery, they get 5 to 10 ectopics. Like once you are coagulating uterine artery and cut and suddenly bleeding has started, you have that, and you have anxiety. Your pulse rate increases. You will not notice that because your attention is on the artery, not on your heart, because you have a anxiety and you are attempting to catch it and it is not catching, ectopic started. So generally heart attack also happen more to the laparoscopic surgeon. But there is only one laparoscopic surgeon which I respect a lot, because I personally know him also. His name is Professor George Bursey. And George Bursey, do you know why he lived 103 years? That he is an American surgeon and he stopped doing laparoscopy after age of 80. And he started doing robotic. And robotic he performed one day before he died. This is Professor Bursey. And he started doing robotic. And still operating, means up to 101. And he died in age of 103. 1921 he born and 2024, last year he died. So if you want to live more, you should learn robotics. And once you are a robotic surgeon, you have a less, because sitting and performing the surgery, 3D vision, and it has a great advantage, tremor filter. Once you, after 75 years of your hand will start getting tremor, isn't it? So hand has a little like tremor. And if you do laparoscopy, your instrument has tremor and you cannot take a bite, you cannot suture. But if you are a robotic surgeon, it has a tremor filter. So even if you are an alcoholic, even if you are a smoker and you have a tremor, robot will filter your tremor. And it will only real command it will take, tremor will filter. So coming back to the main idea that Professor Bursey has performed one surgery. And 1 year later, patient has again pain, patient went for ultrasound. And ultrasound has shown that CBD stone is there. And patient was British, so patient went to Professor Cuschieri. He is one another giant, Professor Sir Alfred Cuschieri. And this is the Professor Sir Alfred Cuschieri. He is called father of laparoscopy in Europe. And fortunately, he is my professor also. I did my master's under him. This is me, this is professor. And I was his, this is professor, this is me. And I was his registrar also. I did my master's in minimal access surgery, my MRCS under him, and then I was his. So Professor Cuschieri has performed the surgery of CBD stone, and out of curiosity, after taking the stone out, he cut the stone. And then he saw that there is a cat eye. This is cat eye. Can you see that? Cat eye. This is not cat eye. Cat eye is this. So if you see cat eye, outside is yellow, bile salt, bile pigment was deposited, and in the middle titanium stone was visible. And then he has given the name, that is cat eye stone. And then it become popular all over the world. So these all are cat eye stone. What is cat eye stone? A rare type of bile duct stone that forms around the metallic surgical clip that has migrated in the laparoscopic cholecystectomy. So titanium clip has one more problem, that if you are applying the titanium clip and suppose a structure diameter is more than the clip. If suppose this is the clip, this is duct and clip is projecting either side, then it is okay. But suppose there is a dilated clip and anyhow you are skewing it or applying one from this side, another from that side, because you don't have large size or you don't know knotting, then anyhow you have to apply clip, and then those clip will migrate into the lumen. and then it will make cation stone. And up to 2004, 360 cases of cation stone is already reported. So this is why suturing and knotting is the best method of tissue approximation. Because clip may not work, but knot can be applied on any structure, even if you do partial cholecystectomy, even if you do in-mass ligation, even if you have a dilated, even if you have Mirigy syndrome, you can apply the knot. And titanium clip is not completely safe.